Hello and welcome to the webinar. We're here to share back about findings and recommendations from a project in the South Suburbs Innovation Zone to learn more about how to increase enrollment of child welfare involved children in early learning programs. My name is Renee Tetrick, and I also have here with me Debbie Bridges. And before we get started, I just want to make sure that everyone can hear and just go through some quick GoToWebinar tips. So if someone can just type into that question box, let me know that you can hear. All right, I'm getting yeses, you can hear. Okay, great. If anyone's having trouble, feel free to just type in there and we can see what we can do to help. Okay, great. So let me just go through some quick webinar tips. So as you can see, we have you muted, but if at any time you're interested in asking a question, you can raise your hand and we can take you off mute. We will have time for Q&A at the end, so we might save some of those questions for the end, but if you have any sort of quick clarification, we're happy to stop. You can also just type your questions right into the question box at any time throughout the presentation so that you don't lose track of your questions. And Fiona Anderson's here with us. She's going to help us to track those questions. And like I said, we'll pause in between if there's something we can clarify while we go through the presentation, but we'll have some time at the end for some Q&A as well. All right, so let's go ahead and get started. I also wanted to let you know that we are recording the webinar, so you're aware of that, and we can share out the recording and the presentation afterwards. So I just wanted to give a little overview of what we'll be sharing today. First, we're going to share a little bit on the background and context for this project, as well as the research methods that were used. We'll then review bright spot strategies, or those things that are currently working well and could be scaled up. Next, we'll review some opportunities to test small experiments. And then we'll offer some ideas for state-level consideration, additional considerations, and future research. And then, as I said, we'll leave time at the end for some Q&A. So there's a lot of information in these slides, and within and interviews conducted in Thornton Township. So that's the findings paper. The one we're going to spend the majority of our time here today is the memo, and that's titled, it's in a memo format, and it's titled Opportunities to Increase Enrollment in Early Learning Programs based on focus groups and interviews with child welfare professionals and parents. So just want to make sure you have access to those. And I just want to check on the sound. I have a little comment here. Okay, sounds like sound came on and off, so okay, I think we're okay. Thanks for letting us know. All right, so I'm going to go ahead and turn it over to Debbie, who's going to share a bit on the background and research.
Okay, thanks, Renee, and thank you all for joining us this afternoon. As Ray mentioned, I just wanted to give a little background on kind of the project and how it all started. Project Link, which was a project conducted by Children's Home and Aid with a federal grant to collect data on enrollment of children involved in the child welfare system in different areas throughout Illinois. And Illinois Action for Children partnered with Children's Home and Aid to do an expanded data collection process in Thornton Township, and with the idea that the data collection could inform Illinois Action for Children's commitment to building capacity and high-quality early childhood education programs and trauma-informed instruction within that particular innovation zone. So that data collection revealed that there were some areas for improvement for enrollment for children 0 to 5 in foster care, particularly in programs like Head Start, Preschool for All, and Gold Star rated programs, and found even lower rates of enrollment of children of parenting wards of the state, and also low enrollment in home visiting and home-based programs. So with that data, then we undertook this next stage of the project, which is more of a qualitative research project, and that was a focus group undertaking to gather kind of some more in-depth knowledge about some of the reasons behind the rates and try to get a better understanding of what parents' experiences were and child welfare professionals' experiences were with trying to connect children to early education programs. So specifically the research methods, as I mentioned, we designed a focus group research project, and in general it was put together so that we could get a sense of everyone of parents and children's, or excuse me, parents and child welfare professionals' perspectives on the whole process. So we put together scripts, developed scripts that would in essence design these conversations to include the same kinds of questions for everyone, so that the content would in essence be the same, but we could get an idea of what everyone's different perspectives would be, and we could compare those. The conversations were sought to kind of get an idea of what's working in the system, what's not working, how might things work differently, how things can be improved. So we divided these groups of parents and professionals into different focus groups, and we conducted four of them, one with child welfare supervisors, one with foster care caseworkers, another with TPSN and intact family caseworkers, and then a fourth focus group with foster care parents. To gauge experiences of parenting and pregnant youth in the foster care system, we actually conducted telephone interviews. And we had a sixth group of parents who we were interested in getting some input from, and that would be parents receiving intact family services. And we actually were not able to gather those parents, so we actually have some suggestions on some further research maybe involving those parents to get their perspective. The next stage was to analyze the data and the findings that we had gathered from these interviews and from these focus groups and the different perspectives that were given us. And the first stage was to give to Maple Grove Objectives, which is a consulting firm here in Chicago, the transcripts and recordings of our conversations. And they did a real complete analysis of the conversations. And you, as Renee mentioned, have a copy of their findings report, which included some input from those of us who were at the conversations as well. The second stage was to go through this process of this pathway for change process, which we did based on those findings as well as kind of a re-review of the transcripts, and trying to get at identifying what issues were uncovered in the conversations, what some of the root causes might have been, and then some strategies to really go at addressing some of those root causes and solving some of those issues. So then this final stage, again, as Renee mentioned and you have a copy of, was to take those strategies that we developed through that analysis process and put those together in a memorandum for the school readiness team, the DCFS school readiness team, who, by the way, has been involved with us really from the start of this project, and we've really been collaborating with them on even the focus group scripts and the analysis of this, and then also reacting to some of the strategies, which has been really helpful. So we first wanted to talk a little bit about what Renee had called bright spots, or what's working within the system. And these are areas that are currently working either for child welfare professionals or for parents to successfully connect children with early learning programs. And these are things that are working that have the potential to scale up and to build on and to bring to other groups of caseworkers or other groups of parents. And there were many bright spots that were summarized in the Maple Grove Objectives report, but we're highlighting just a few of them, just 3 of them today. And the first one being the Teen Parent Service Network staff and caseworkers, both their knowledge base and their commitment to supporting parenting wards of the state in enrolling children in early learning programs. So kind of more specifically what's working, the caseworkers and parents actually who we talked to as well talked about some things that were working for them. And one is that caseworkers and staff really taking on this hands-on navigator role with parents, and that was working to help connect them. Annual trainings and frequent supervision for CPSN staff and caseworkers that included regular discussions of early childhood education. It's important to child development. That was something that was working. And then also CPSN monitors were reported as being very supportive of caseworkers taking on this additional navigator role with parents. So just to mention just a couple of these opportunities to scale, and as Renee mentioned, we've got a lot to cover, so I'm just going to cover a couple of them. One being the possibility of DCFS offering twice yearly trainings by TPSN staff, caseworkers, for other caseworkers, for foster care caseworkers, or those working with parents of intact family, receiving intact family services. Another might be that DCFS could leverage innovation zone work and also TPSN expertise and draft a step-by-step guide and script for piloting, perhaps within Thornton Township, and that would be a script that would kind of go through this navigator role that these caseworkers seem to have taken on with parents. A second bright spot came up in our discussion with foster care parents, and that was this group of parents being very resourceful and successful at navigating the process themselves, using a number of different strategies, whether driving around, whether word of mouth, whether Google searching, but also feeling very supported by their caseworkers when they needed them, particularly for things like paperwork and documentation. So looking to leverage or build upon this resource within the group, within foster parents themselves, opportunities might be bringing together a group of foster parents who successfully navigated the process, bringing them together at, say, for example, a foster pride meeting or a parent cafe, something like that, to share with others how they have successfully enrolled their children. Also, perhaps connecting more on a one-on-one basis, caseworkers just connecting their clients with those who successfully navigated the process, with those who are starting to undertake it. And that actually kind of even occurred within our focus group itself. There were people finding resources within that group and learning new things and getting information that was helpful to them in terms of enrolling their children. And then the last bright spot, and this one we've done a little revising of since having gotten some reaction from the school readiness team. But one thing that some caseworkers mentioned was the role of education liaisons being kind of key and supportive to them in assisting with enrolling children, with finding programs that had the services that children needed, and not only navigating the process, but then also this more, I think, this other role of education liaisons in terms of advocating for child welfare involved children. Caseworkers felt that they could go to these liaisons for that kind of support as well. So that was reported to us, and so we had the thought of kind of building on that and promoting the use of education liaisons with caseworkers and supervisors, also perhaps expanding the cadre of liaisons throughout the state. But I think with some input from the school readiness team, it seems that there might be some maybe additional opportunities or slightly revised opportunities that actually Renee will touch on in just a bit.
Okay, so the next section of the memo includes opportunities for small experiments. So these are strategies that are effective and feasible at increasing enrollment of child welfare involved children in high quality early learning and development programs. So the strategies are designed with a behavior economics frame. Research finds that decision making is particularly difficult for individuals experiencing great stress. And families experiencing great scarcity are highly sensitive to any perception of difficulty. So choices might feel difficult when time, money, mental ability, physical ability, and habits and routines are challenged. So we designed these strategies with those research ideas in mind. The following strategies can be tested now in the South Suburbs Innovation Zones as small experiments to inform scalable policy solutions in the future. So the first recommendation here is to provide additional support to families in navigating the enrollment process. Caseworkers and parents alike found that the navigator approach, and that means assisting with the entire process of finding, choosing, and enrolling in an early learning program, to be helpful and successful in completing the complex enrollment process that was described in our focus groups. One strategy idea for caseworkers is to provide a narrow list of 2 to 4 early learning programs that meet the geographic preferences, program needs, and eligibility of families, and provide written options with a map to parents during specified meeting times. Some other ideas are to utilize a script and provide a step-by-step simple guide to parents and help them to work through creating new activities related to enrollment, and also create an informal network of parent support. These ideas can help to make the process a bit more social, a bit more fun, and easier to navigate. Some ideas for the school readiness team are a strategy around further articulating expectations that all caseworkers provide extra supports for enrollment, such as paperwork support and acquiring documentation. The innovation zones have also created some scripts and guides that can be used to help make the steps of the enrollment process more easy. The next recommendation is about delivering consistent messages and supervision to set the expectation for caseworkers to enroll more children 0 to 5 in high quality early learning and development programs. In the focus groups, conversations around the role of caseworkers varied from sharing information to referring to navigating. Caseworkers tend to take on different roles based on time, priority of child safety, caseload, experience, and resources. Research in behavior economics finds individuals make quick decisions based on available information. The practice of planting and priming serves to nudge quick decision making to the preferred outcome. So you'll see some strategies here based around those ideas. One is to review some onboarding materials with new caseworkers, to provide regular messages to caseworkers that are in transition and turning over to new positions. Another idea is to provide regularly planned brown bag lunches with caseworkers to help bring people together around the importance of early learning and to discuss the steps of the process, such things as how to refer, eligibility requirements, paperwork needs, documentation, and follow-up plans. For DCFS, some ideas are to leverage existing channels to regularly communicate and build knowledge for caseworkers. This could be done through regular email updates and utilizing their DNet internal webpage to provide up-to-date resources on early learning. So I'm going to go ahead and turn it over to Debbie to share our next set of recommendations.
This next opportunity for a small experiment is around providing some clarification and support around documentation and paperwork requirements, and also around priority eligibility status of child welfare involved children. And kind of the context for this, or the conversations that led us to this kind of larger theme or larger issue, is that a common sort of across the board frustration of many of the parents and caseworkers was this frustration with documentation and the timing of documentation and what actually was needed and what wasn't needed, and then the variation between the different programs. And then also having a program be full once identified, and feeling good about a program, determining that there were no slots available. So to look at providing then some clarification support around these things, or provide an opportunity for some strategies. The first one is suggested for the school readiness team, and all of these actually are things that, or I should say many of these are things that the school readiness team is already doing some, so it's really an idea of supporting and augmenting their efforts in these areas. For example, the first one, communicating regularly with providers to kind of monitor slot openings, to attend childhood collaboration meetings. Things that are going on right now, but that could be augmented in order to affect enrollment of more children. This last idea is to craft some communications that could be distributed through channels ISB, Head Start, CPS, to send through their regular communication channels about not only reserving spots, but also about the documentation challenges that that families, foster care families, and other families in the child welfare system might experience, and ways that you can support and can help them to navigate that process. And then this last opportunity for these small experiments, these were things that we identified as being feasible and effective and things that could be done kind of right now, is to reemphasize DCFS's shared goals and protocols for connecting child welfare involved children 0 to 3 with early learning programs. And again, just to get a little context around this, is that all the discussions in the focus groups and the interviews around early learning programs for these younger children really uncovered a wide variety of definitions of the programs for young children, but also a wide variety of approaches in terms of connecting or not connecting young children with these programs. Some people focusing really just on programs for children with indicated needs through screenings, and others had a broader definition that would include programs for all children 0 to 3. In all the discussions, very few people discussed home visiting programs or home-based programs either. So we thought this was a real opportunity for some strategies. So for the school readiness team, providing some links to home-based programs, program databases, and hard copy lists to caseworkers to encourage them to look at that as an option for these younger children. Also providing up-to-date information on home-based programs to educational liaisons, as I mentioned earlier, education advisors, and to others. Also an opportunity maybe to host some brown bag lunches to connect caseworkers with home visitors or with NCV representatives. On a slightly broader scale, some DCFS strategies and that might help to reemphasize and maybe even provide some clarity on goals and objectives with these younger children would be to organize and targeted effort as part of the strategic planning process to really look at new and revised policies that might be, and practices that might be put into place in terms of enrolling children 0 to 3. And to do that, to perhaps pose some questions in what's left of any of the town hall meetings, but also we are actually putting together some thoughts and some feedback on the strategic plan, specifically for strategies related to these younger children. So kind of leading those smaller feasible experiments, looking at some opportunities that were suggested by some of the themes in the focus groups and the interviews, some opportunities for some state-level policy strategies. This first is, and this is related a little bit to one of the other opportunities we've already talked about, but the opportunity for state systems to clarify and offer some strong supports around documentation requirements and also prioritization of child welfare involved children. So different from the other ones, these are things that are higher level and are not necessarily something that can be done necessarily so quickly, but nonetheless were suggested as possible strategies to help more parents and to help caseworkers in enrolling more children in early learning programs. So the first being that the idea of standardizing eligibility requirements across all learning systems. All of these ideas really looking to make the policies consistent and simplifying the process for caseworkers, for parents, and actually for providers as well. So to look at some of the policies, perhaps, for example, the preschool expansion grant policy as a model for standardizing eligibility requirements across all programs. Looking to revise perhaps school district residency policies. Some of the conversations talked about not having spots available in their preschool for all, or not preschool for all, but in their preschool in their local school district program, but there were in the next door district, but they were not allowed to enroll in those. So looking to maybe have a little more flexibility with that, as is in some of the policies, in some of the preschool policies. And then finally, to maybe be a little more explicit, as the preschool expansion grant policy is, in terms of withholding a certain percentage of slots unfilled for the first couple of months of school to support late enrollment of children, not only homeless children, but children involved in the child welfare system, and then also those of other high needs. So those are some of the bigger, broader ideas that might address some of the issues that came up in the conversation.
We also found some opportunities for community systems development, opportunities for state systems to provide cross-sector training and assistance, and community systems to support families in connecting and enrolling to early learning programs. So some context around this is that some case workers reported challenges of understanding early learning documentation needs. Caseworkers also said that some of the early learning programs do not understand child welfare categorical eligibility. Project Link surveys of early learning providers in the South suburbs also reported challenges of understanding the issues that impact child welfare involved children, and that there's some lack of coordination between them and the caseworkers that could be improved. Some families also mentioned having difficulty obtaining medical documentation when they do not have a primary care physician. So we have some recommendations around those ideas. One is to hold cross-sector trainings between child welfare agencies and early learning programs to learn about each other's systems, to strengthen relationships, and to build knowledge and capacity for enrolling and serving child welfare involved children. So we know some of these cross-sector trainings have been going on, and that even in the South Suburbs Innovation Zone, some of this work has been done as well. So it would be kind of building on that. Another is to provide training and technical assistance to collaborations to help families in locating primary care physicians and obtaining that required medical documentation. We also have some ideas for additional innovations that could be effective at reaching our target goal. While they're feasible to implement, they may require some additional planning and guidance depending on available resources. So that's why we included those as an appendix to the memo. Two that might be of particular interest right now are the formal parent support network and also taking a deep dive on referral resources. Those were mentioned in our conversations with the school readiness team as possibilities. And then we also found some areas for future research, and I'll turn that to Debbie.
Yeah, these were things just as those areas of consideration were that kind of came up in the conversations, but were not really delved into deeply, but certainly suggested some themes, some ideas, some issues worth considering for further research. And I'm just going to mention a couple of them. The first one being ways to support short-term intact families and their support teams, their caseworkers and supervisors. Again, as I mentioned, this was not a parent group we were able to engage and get some direct input from, but thinking that that is certainly an area for further research and might involve exploring a number of things, including the use of protective daycare and its potential effectiveness in supporting families who might not otherwise be eligible for child care, even in that short-term window in which they're engaged with the child welfare system. Another one was this idea of family perceptions and mindsets related to screenings and social service systems. This was something that came up primarily in our conversations with caseworkers and supervisors, families feeling a resistance to screening or feeling that it was feeling judged by the screening process or the enrollment process, that kind of thing. We didn't necessarily hear that from parents, but from caseworkers who thought that was an area that maybe would be interesting to look more into. And then finally, the last one, options for family, or excuse me, the second to the last one, family transitions to and from different programs and from different subsidy sources. Finding that these transition points from one school to the next, whether it's moving, whether it's going from a 0 to 3 program to a preschool program, but then also transitioning from DCFS to CCAP subsidy programs, all of those being sort of friction points that might be intervened in order to keep the children enrolled and make it easier for parents and for caseworkers to do that.
So we're also really grateful to our DCFS school readiness team. As Debbie mentioned, they've been along with us throughout the process, really informing the focus groups, the questions in the focus groups, giving feedback on the memo, and it's been really great to work closely with them. So we've shared all the findings in the memo with the school readiness team, and we also had an opportunity to interview each of them individually to kind of walk through the memo, really understand which strategies seemed feasible and most interesting to them to move forward. So we've received some great feedback, and we highlighted just a few areas here. Also wanted to note, so I'll walk through some of these, but also wanted to note that we're in the process of revising the memo based on that feedback. So we'll be kind of editing certain sections to include their input to make things even more clear and more feasible. And then we'll also be adding an addendum to the memo that kind of summarizes those areas that they really think are most feasible and most ready to move forward. So just a few ideas here. One that popped out to many of the members of the school readiness team was this idea around brown bag lunches. So bringing together caseworkers, they thought this would be a great space for caseworkers to talk, and also really inviting in those providers of service agencies to make sure that they're a part of these conversations as well. It could be a really great informal space to talk about enrollment and kind of the steps of the process so that they're kind of leveraging each other's knowledge. Another is to create both an informal and formal network of foster care parents as resources. So we found in our innovation zone work too that this can be really helpful, these peer networks of supports, whether it's parents working with parents, providers working with providers. So along with this idea of caseworkers having their own brown bag lunch, how to support these informal or formal networks of support for foster care families that have navigated the process and can help others to work through that process too. Makes it a little more social and fun and easy to work through that process when you have the support of a like other. Another is to provide even more relevant and accessible information on early learning on the DNet. So the DNet's a resource that's used a lot by caseworkers, and the school readiness team just had a lot of ideas on how to put things on the DNet that's a little bit easier to find, how to make the information more relevant, how to really work with caseworkers to kind of check that as a resource. So that was one area noted by each member of the school readiness team. Another was to provide clarification on the role of the education liaison in the school readiness team. So as you heard in our findings in the focus groups and the interviews, many people mentioned the helpfulness of the education liaisons. And what we learned through the school readiness team is that their role really is around advocacy. And while they can refer and they can do all those things too, and the school readiness team thought it would be helpful to kind of clarify those different roles, so then the school readiness team can be available for being that main source of referral, and the education liaisons can really help with what they're most knowledgeable and equipped to do, which is around advocacy. Another idea is around conducting regular training and onboarding for new caseworkers. We talked about how there's transition, there's turnover within the system, and how having that regular onboarding process, sharing the role of that caseworker as a navigator could be really useful. And then finally, many of the school readiness team members mentioned the importance they see around 0 to 3 as an added part of their strategy. They're focused now on 3 to 5, so how that can be a part of the DCFS strategic planning process going forward. So those are some of the things that kind of came out of those interviews with the school readiness team that we'll be working into a revised version of the memo. So we also wanted to share back with you just our next steps going forward. So we'd like to request your feedback, those that are on the phone from All Family Serve, but also the Community Systems Development Subcommittee and others that have joined us today. So we're going to have time for you to ask questions, provide feedback today, but you're also welcome to email both Debbie or I with those feedback points. We're also planning to review the draft findings and recommendations with the state's early learning interagency team. We're hoping to discuss the findings also with the DCFS leadership, and again with the school readiness team. So we have a meeting scheduled there that we're really excited about. We'll also be sharing back the findings and recommendations with the South Suburbs Innovation Zone team, and we're hoping to find some opportunities to pilot test some small experiments in the coming months. All right, so I wanted to pause there. That was a lot of information, and I just wanted to see if we could take some time for questions. You're welcome to raise your hand, and we're happy to unmute you so you can ask your question aloud or provide your feedback aloud. And then we also have some questions that have come here on the chat box. So feel free to, you can type in additional questions in the chat box or raise your hand. We're just going to take a pause here to look through those. We can double click on it. So we can read them out loud, and so the first one we have here is, do we have data by geographic location on an annual basis about the number of child welfare involved children 0 to 5? I'm wondering if programs can anticipate the number of child welfare involved children might be eligible for early learning programs.
This is Debbie. I guess this is not data that we have, but at the expense of putting them on the spot, I would suggest that perhaps the school readiness team would have access to that kind of data, at least with foster care children, and TPSN might have some data on children of young parents, but that's not data that we would have.
Yeah, I believe that's right. I believe I've been in a meeting with Mary Beth where she's kind of pulled up data on this before, so we can certainly follow up with her and see what is available and share that information back. That's a great question. All right, let's see what else we have. All right, that looks like our only question so far. Let's see if there's any hands raised. Let's see. Madeline, we see your hand raised. I don't know if that was from before, or would you like to go ahead and?
That was before. That was from before. I actually wrote it out.
Oh, okay, great. Did you want to share anything now or ask a question now?
Well, actually, I wanted to follow up on the question I asked. You know, it would seem to me that maybe we want to have more definitive information about, are there particular communities where 5 to 10% of, might need more than 5 to 10% of the slots available in the first couple of months, and then perhaps in some other communities we might not need quite that number, which is why I was asking about, do we have access to the data?
Yeah, and that is a good question, Madeline. And Renee mentioned our conversations with Mary Beth, and I know that she and her team and others, I think, on the child welfare work group have been talking about trying to kind of map out concentrations of children who are involved with the child welfare system. Who, yes, in fact, that might help to give you know, a better sense of what percentage really should be held back and allotted. So that's a good question that we can certainly pass on to her.
Okay, any other questions? So here's one asking, curious to know how many school readiness teams are connected to existing early childhood collaborations or LICs. Can you provide the link from the Partner Plan Act website to them so they can reach out to collaborations? Yeah, so that's a great question. That was definitely one we can follow up with the school readiness team to see which collaborations they're connected to, who they're working closely with, and certainly share any sort of resources on Partner Plan Act. You might see in the memo we have an idea of connecting caseworkers to Partner Plan Act because there are really great resources there on community systems and how to improve our sort of alignment and pipelines for high needs families. So thank you for that idea. Any other questions? Okay, we don't see any others coming in, but do let us know if we missed anything. Feel free to type in again or raise your hand. We do have a few more minutes, and we have some questions here for the audience. So as you're thinking of any sort of additional questions, feel free to type those in, and I'm going to direct them towards you. So I'm curious from the audience, what caught your attention from the memo? What kind of stood out from you or got you excited from the memo? Feel free, yeah, on any of these questions you can raise your hand if you want to speak aloud, or feel free to type into the question box again. So I'm curious, what kind of stood out to you? What caught your attention from the memo? What was sort of intriguing to you? I think Madeline's unmuted.
This is Madeline. I was very curious about the intact families not participating, and I was wondering if there was any, if you got any feedback why that was so, because, you know, I would hope that we could engage them before things got really serious and have their children in early childhood programs where both the child and the parent could get the kinds of supports they might need.
Yeah, and we agree. But yes, it was, and I think we don't necessarily have definitive answers on why it was so difficult to recruit a group of participants for that conversation, who parents who are receiving intact family services, but certainly can speculate that it's the the short-term nature of the services that they receive, I think, make it additionally challenging. And certainly that's what we heard from the intact family services caseworkers, was that there is just so much to be done in a very short period of time that enrollment in early learning programs is not necessarily top on the list. But certainly the caseworkers and the supervisor as well, who worked with intact families, agreed that it needed to be a higher priority, but it was, but it often goes by the wayside. But that's certainly why we suggested it in this area for some additional research, because it certainly is a group of parents that it would be good to learn a little bit more about their experiences and what's working and what's not working for them.
Madeline, this is Leah Powell, just to add in. So with some of the work that we're doing and trying to gather information and gather diverse perspectives from folks from who are experiencing different services, we keep finding over and again that focus groups end up being a very difficult way to get people together, especially our most vulnerable populations, because so often they're not able to make time or they don't know us. So there tends to be lower turnout for some of the focus groups that we've tried to offer while trying to gather diverse perspectives. I'd say that some of us have been able to go to some of the training through the Able Change framework process, and they have created some really useful tools about getting voice, from different surveys of places where families are already attending, where they're already completing a survey, So a focus group, you may not be able to get the dialogue, but there's a way that we can try to keep gathering information just to keep trying to gather that diverse voice. Because without the voice, we're not going to know every point of view. We're not going to know every situation. I think that these two, they did such a great job, and Chris Foster, will give her kudos for helping to coordinate that work. But they worked really hard to try to get the different voices, offering focus groups at different times of day, different locations, really trying to be accommodating to where families are at. And if anybody has other ideas or tips that they've had, I know that we would always be welcome. Just what's been a winning, I guess, activity that you did that got more people to share their perspective from really underserved voices.
Anything else from the memo that was intriguing or that caught your attention? Maybe to ask the question in a different way, I'm curious if there are any, from kind of your perspective, from your work, are there any strategies that you think are most important, that you think are really high priority, that should be focused on right away? And of course, feel free to raise your hand or type into the question box. Oh, the strategies are great. Glad to hear.
Well, and as Renee mentioned too, we certainly welcome anyone's emails or telephone calls, anything like that, to give us this kind of feedback if we want a little more time to digest the memo. We sort of breezed through kind of a top-line summary of the memo. So if there's anything that does jump out at you or strategies that you think should be prioritized, it would be helpful to know that.
Yeah, either ones that should be prioritized or ones that you think would be really challenging and why they might be challenging. So I'm going to give just one more minute for anyone to share any thoughts on strategy you think is top priority, most feasible, or one that you think might be challenging and how we might be able to address that. Well, as Debbie said, feel free to email either of us any thoughts on the memo. We welcome your feedback. As we mentioned, we'll be revising that to share back with the school readiness team, with DCFS, with the interagency team, and with the South Suburbs Innovation Zone. So I want to thank you again for your time and your attention and your great comments, and we look forward to any feedback that you may have. Thanks so much for your time. Have a great day.
Thank you.